Uh, we now move on to the next talk. The speaker is Dr. Anmol Sodhi from India. She talks on teledermatology in India during and post-COVID outbreak, advantages, shortcomings, and challenges.
Good evening. I'll be talking on teledermatology in India during and post COVID-19 outbreak, the advantages, shortcomings, and the challenges. There are no conflicts of interest to declare. As Sir Newton told, no great discovery was ever made without a bold guess. So in our case, the bold guess was the use of teledermatology. Now, in April 1924, there was this radio news magazine which ran a splashy, futuristic cover story, The Radio Doctor Maybe, where the kids were seen sitting around a new-fangled doohickey and saying, "Ah," for a distant doctor seen on a video screen. Teledermatology is defined as the use of electronic information and communication technologies to provide healthcare support when distance separates patients from healthcare professionals who have expertise in the field. It was probably first meant for rural communities or soldiers in faraway lands who had none or little access to the physicians. It started in around 1970s, and when telemedicine is used in dermatology, it is called as teledermatology. Although it is available since pre-COVID-19 era, there has been a huge surge in the teledermatology services thereafter. And as dermatology is a visual subject, it is even more suitable for teleconsultations. Looking at the global scenario, we stand only third. And the countries have reported 10 to 15-fold increase in teleconsultations during the pandemic. The objectives of the study were to know the advantages, shortcomings, and the challenges of teledermatology in India, both during and post-COVID-19 outbreak. It was a single-center retrospective observational study conducted at a tertiary care hospital in India, started after taking the clearance from ethical committee. The teleconsultation data starting from 1st April 2020 till September 2021, that is 18 months, was included in the study. Real-time, asynchronous, store and forward, and hybrid models were used. Patients were given the teleconsultation platform numbers and the timings for the consultations. Whosoever could connect to the doctors during those timings were provided the real-time video consultations or hybrid mode consultations, and those who could not connect during the teleconsultation timings were put in asynchronous SAF mode. Patients who availed teledermatology consults during the aforementioned period were included in the study. All the required data, including the age, their sex, their residential status, including rural or urban, mode of teleconsultation, their presenting complaints, the diagnosis, treatment, need for physical consultation, further evaluation like physical examination, need for blood investigations, skin biopsies, difficulties faced during the teleconsultations, and quality of pictures were noted and entered in the Excel sheet. And the analysis was done using the SPSS software. During these 18 months, a total of 4280 patients took the teledermatology consultations, and all these patients were new patients, non-follow-ups. The follow-up was done by doctors at local healthcare level. The mean age of the patients was 34.19 years. Most of the patients were in the age group of 31 to 40, followed by 20 to 30 years. Because of their tech-friendly age group, males exceeded females in the study. Both rural and urban population took teledermatology consultations. SAF was 70, hybrid in 16, and RT in 14%. Clear pictures were not available in 4.2% of the cases, and all these were store and forward types of teleconsultations. The diagnosis could be established in 89.1% of the cases, and the most common diagnoses were superficial fungal infections, followed by eczema and acne, and all the diagnosed patients were prescribed the treatment. These were the most common diagnoses. These are a few of the clinical pictures which we had obtained during SAF. Hospital visits were required in 10.9% of the cases to ascertain the diagnosis, or there was some error in the connection in 1.37% of the cases. 1.3% cases, the provisional diagnosis was made, but additional diagnostic tests like skin biopsy, blood antibody profiles were required to ascertain our diagnosis. Physical examinations were required in 1.05% of the cases to know the severity and extent of the disease, and in patients like Hansen's to confirm the diagnosis. Life-threatening conditions like drug rash, pemphigus, or flares of lupus requiring hospitalization were present in 0.39% of the cases. Referral was required in 0.37% of the cases. Coming to the advantages of teledermatology, post-treatment improvement was present in 86.05% of the cases, which is a huge number. Decreased needs of hospital visits in the cases. It provided screening of the people requiring hospital visits, so it catered to the overcrowding, it reduced the spread of COVID-19 infection, provides expert quality of care for people who live in rural areas, who otherwise have limited access to better healthcare, which is very important in our country. Coming to the shortcomings, lack of good quality pictures, technical errors, inability for a physical examination or a detailed examination, need for further tests like skin biopsy, blood worker profile, which cannot be done at rural healthcare levels. It is not suitable for treating patients with life-threatening conditions. Real-time video consultations are more time-consuming, even more time-consuming than the physical consultations. And in SAF, dermatologists can't really dig deeper into the history, which could impact the diagnosis. Challenges: poor internet services, mainly in the rural areas, and lack of expertise in capturing adequately zoomed and angled pictures, and poor video quality during the consultations. So mainly these were operational challenges. Discussion. So as we all know, there are various models of teledermatology like store and forward, real-time, and hybrid model. SAF is convenient as patients can upload their history and pictures at their convenience, and doctors can review them and have no time constraints. Teledermatology truly serves as a triage platform and helps to reduce the hospital visits, helps to cater the rural population who otherwise have limited access to healthcare. Few technical challenges are the dependence of teledermatology on pictures and information which is sent by the patients or doctors at primary healthcare levels for establishing our diagnosis, difficulty in explaining their problems clearly over the virtual platforms. So decreased need of hospital visits and providing expert healthcare to the rural population is very important. The challenges, so previous studies, we can see the major challenges faced by physicians including difficulty in assessing the morphology and topography of the lesions, higher time per consultation, difficulty in establishing rapport, poor image quality, patient not picking up the calls, and so on. So the challenges are mainly operational: poor quality pictures, poor video quality, difficulty in using the teledermatology portals, difficulty in extracting details history, difficulty in establishing rapport, lack of good video quality, and female patients were mainly uncomfortable sharing the pictures. Will dermatology be the silver lining during and after COVID-19? It is not appropriate for all skin disorders. The medical legal standpoints are there, prescription misuse, lack of patient contact, and need other doctor to take clear pictures. Shortcomings: lack of good quality pictures, technical errors, not useful for life-threatening conditions, difficulty in establishing rapport. This was the article, How the Internet is Changing Us, Our Patients and Our Practice. So many of our latest smartphones have these beauty filters which make changes to the photographs, especially the selfies, and provide us with undesirable pictures. Limitations: it was a single center study with an already established telemedicine unit, which could have led to bias in the study. Secondly, as the patients are not followed up physically at the tertiary healthcare center, accuracy of diagnosis could not be established. Different barriers as seen in the literature are duplicate entries, incorrect contact details, so we cannot really follow up our patients, connectivity issues, technological inability of the patients to send the pictures, hesitation in sending the pictures, and poor understanding of the hybrid model. Scope of teledermatology: as per the survey done by Sharma et al., over 70% of the dermatologists plan to use it in conjunction with physical consultations. 15% claimed to not using it at all, and 10% said they would limit physical consultation while using more of teledermatology. One more study: the percentage of respondents using teledermatology for both follow-up and new patients increased from 37.2% before to 67% during the pandemic. The most common disorders which can be conveniently treated using the teledermatology are acne, rosacea, non-severe cases of psoriasis, atopic dermatitis, and eczema by teledermatology. The most common diagnosis in our study was superficial fungal infections, which could be easily managed on teledermatology platforms, followed by eczema and acne. To conclude, I would say no man ever made a great discovery without the exercise of imagination. So teledermatology truly serves as a triage platform, helps reduce the hospital visits, helps to cater the rural population who otherwise have very limited access to the healthcare. Few technical challenges are dependence of teledermatology on pictures and information provided by the patients, and sometimes patients face difficulty in conveying their problems clearly to the doctors. Because of the ease and advantages, many dermatologists have continued to use the teledermatology in addition to physical consultations post COVID-19. And with a few advancements, teledermatology is going to prove to be a useful model for consultations, primarily in resource-poor settings like ours. I would like to acknowledge Dr. Shobham and Dr. Rohan. These are my references. Thank you.
Thank you, Dr. Anmol. Yes, it's not just resource-poor settings, but also with the more availability of smartphone and internet, which is easily available in India. We have smartphones with every other person, and the access to internet. So we are seeing a lot of rise in teledermatology, and people find it very convenient. Thank you once again, Anmol.